Hi, I'm Dr. Bindu Sthalekar, dermatologist and cosmetologist. Today I'm going to talk on adult acne. So now treatment of acne, of adult acne. Here let me start by telling you that adult acne differs very slightly from adolescent acne. What is the difference? The skin of people with adult acne is less oily. Is not as oily as teenagers, number one. Secondly, the mature skin is a little bit more sensitive. So it cannot tolerate all the creams and all the medicines which a teenager can tolerate. So remember these two differences before you pick up anything and start applying. We divide acne into mild, moderate, and severe. Mild acne, there'll be only a few zits, a few lesions that you can treat yourself. Now, how do you treat it? By using the right cleanser. The right cleansers which you can use is cleansers which contain salicylic acid, so 1 to 2% salicylic acid, or salicylic acid helps to unblock your pores. So the beginning of acne, that is clogging of the pores, is diminished. So that will be effective. Or you can even use glycolic acid washes, about 3 to 6% glycolic acid washes. That is anti-inflammatory, so that will help. So these are the cleansers you can use. And if you few zits which you have, you can also use over-the-counter benzoyl peroxide. Benzoyl peroxide comes as a concentration of 2.5 to 5%. But a word of caution over here, benzoyl peroxide is not as effective in adult acne because it may irritate the skin and it may cause an allergies. So benzoyl peroxide can be used if after you can use it after doing a patch test. That is antibacterial and anti-inflammatory. So if it suits you, you can use benzoyl peroxide. And you can also use azelaic acid, 10 to 20% azelaic acid. Now azelaic acid, it's mild, and also it takes longer to act, but it is one I want to mention over here, that it is safe in pregnancy. So if you feel that there is a chance you may get pregnant, you're married, you may get pregnant, then azelaic acid is the medicine for you, or even glycolic acid, but do not use salicylic acid or benzoyl peroxide or any topical antibiotics. So coming back to azelaic acid, 10 to 20% azelaic acid, it can help the redness, and also acne, post-acne, you can get pigmentation, that is post-inflammatory hyperpigmentation. So azelaic acid is effective in lightening the dark spots which have been left behind by the acne. So azelaic acid, and of course we have topical antibiotics, not to be used by yourself. This has to be prescribed by a dermatologist. Over here, the mainstay for adult acne is retinoids. Now there are certain retinoids which are available over the counter, retinol, retinaldehyde, which you can use on your own, and that has to be used at night preferably. But remember, retinoids are ideal in mature acne or adult acne because they also help to unblock the pores. It helps to cause a little desquamation or peeling, which help in unclogging your pores. And they also have an anti-aging action, so this is very effective in adult acne. And start initially with twice a week application, because if you start every day, every night, the whole night, you may get an irritant allergy or irritant dermatitis. So start slowly. So let your skin get used to it, and twice a week or 3 times a week. Initially start with 2 hours, and then later on you can use it whole night. So retinoids can be used at night. Your dermatologist will prescribe tretinoin, which is a medical grade, and that helps in decreasing the acne. I hope you found this information helpful. Until then, stay tuned, stay glamorous.